What is dengue fever? Dengue fever is an acute febrile disease which occur in the tropics, can be life-threatening, and are caused by four closely related virus serotypes of the genus Flavivirus, family Flaviviridae. It is also known as breakbone fever. It also occurs widely in the tropics. Unlike malaria, dengue is just as prevalent in the urban districts of its range as in rural areas. Each serotype is sufficiently different that there is no cross-protection and epidemics caused by multiple serotypes can occur. Dengue is transmitted to humans by the Aedes aegypti or more rarely the Aedes albopictus mosquito, both of which feed exclusively during daylight hours. What are the signs and symptoms of dengue fever? The disease manifests as a sudden onset of severe headache, muscle and joint pains, fever, and rash. The dengue rash is characteristically bright red petechiae and usually appears first on the lower limbs and the chest. In some patients, it spreads to cover most of the body. There may also be gastritis with some combination of associated abdominal pain, nausea, vomiting, or diarrhea. Some cases develop much milder symptoms which can be misdiagnosed as influenza or other viral infection when no rash is present. Thus, travelers from tropical areas may pass on dengue inadvertently, having not been properly diagnosed at the height of their illness. Patients with dengue can pass on the infection only through mosquitoes or blood products and only while they are still febrile. The classic dengue fever lasts about 2 to 7 days, with a smaller peak of fever at the trailing end of the disease. Clinically, the platelet count will drop until the patient's temperature is normal. Causes of dengue fever. Dengue fever is caused by the dengue virus, a mosquito-borne flavivirus. Dengue virus is an ssRNA-positive strand virus of the family Flaviviridae, genus Flavivirus. There are 4 serotypes of dengue virus. The virus has a genome of about 1,100 bases that codes for 3 structural proteins, C, PRM, E, 7 non-structural proteins, NS1, NS2A, NS2B, NS3, NS4A, NS4B, NS5, and short non-coding regions on both the 5th and 3rd ends. The potential factors causing hemorrhagic fever are varied. The most suspected factors are humans' cross-serotypic immune response and membrane fusion process. Human antibodies produced in response to the virus actually increase the infection. How to diagnose dengue fever? The diagnosis of dengue is usually made clinically. The classic picture is high fever with no localizing source of infection, a petechial rash with thrombocytopenia and relative leukopenia, low platelet and white blood cell count. Care has to be taken as diagnosis of DHF can mask end-stage liver disease and vice versa. First is the fever, bladder problem, constant headaches, eye pain, severe dizziness, and loss of appetite. The second is the hemorrhagic tendency. Third is thrombocytopenia. Fourth, the evidence of plasma leakage. Fifth, encephalitic occurrences. Treatment for dengue fever. The mainstay of treatment is timely supportive therapy to tackle shock due to hemoconcentration and bleeding. Close monitoring of vital signs in critical period is critical. Increased oral fluid intake is recommended to prevent dehydration. Supplementation with intravenous fluids may be necessary to prevent dehydration and significant concentration of the blood if the patient is unable to maintain oral intake. A platelet transfusion is indicated in rare cases if the platelet level drops significantly or if there is significant bleeding. The presence of melena may indicate internal gastrointestinal bleeding requiring platelet and/or red blood cell transfusion. Aspirin and nonsteroidal anti-inflammatory drugs should be avoided as these drugs may worsen the bleeding tendency associated with some of these infections. Patients may receive paracetamol preparations to deal with these symptoms if dengue is suspected.